Sizdik M. Temergaliyevti. The Busitov K. Production.
Hi, so I've heard that you wanted to learn more about stem cells, right? These tiny cells are so interesting and useful that they can even cure cancer. You know, this deadly disease that according to the American Cancer Society kills with a risk of 90%?
Yes, I know.
Oh. Well, today we are going to talk about leukemia and how stem cells are involved in solving this issue.
What exactly is leukemia?
I'm glad you asked. Leukemia is a blood cancer that occurs when the abnormal white blood cells in a bone marrow interfere with the normal function of the body. Mayo Clinic, top clinic in US by the way, mentions the following common symptoms: fever or chills, losing weight without trying, tiny red spots in your skin, bone pain or tenderness, etc.
So how does leukemia form?
There is DNA in your blood cells. It tells cells how to grow and when to die. In leukemia, DNA mutates and tells the blood cells to continue growing and dividing. Over time, the cell production becomes out of control and the abnormal cells start to interfere with the work of healthy blood cells in a bone marrow, which leads to the symptoms we've mentioned earlier. There are four main types of leukemia: acute lymphocytic leukemia, acute myelogenous leukemia, chronic lymphocytic leukemia, and chronic myelogenous leukemia. The most common treatment for the disease is well-known chemotherapy. It involves the usage of strong drugs to kill and stop the growth of cancer cells. However, its main risk is that it also damages healthy cells, leading to an increased risk of other health issues.
A mutation in a stem cell triggers uncontrolled division, forming malignant blasts that fill the bone marrow and blood. FLT3 and NPM1 activate signaling pathways, driving proliferation. Oh no, mutated DNA.
Divide, expand my army.
Aye, aye, Captain!
Cytarabine mimics deoxycytidine but contains arabinose instead of deoxyribose. Once incorporated into DNA, arabinose disrupts the phosphodiester bond, blocking polymerase and breaking the DNA chain, which triggers apoptosis and destroys cancer cells. Cytarabine targets rapidly dividing cells like cancer, bone marrow, mucosal, and hair follicle cells. Slow dividing cancer cells may evade it, require microscopic checks for remaining malignant cells. RT-PCR is a molecular diagnostic method that converts messenger RNA into DNA for amplification and detection of mutations.
Oh no, our patient has a relapse. He has a weakened immune system. We need blood cells to maintain immunity.
But we have stem cells.
Why do we need them?
To create blood cells, Stuart, but it's not so simple. HLA proteins on the surface of cells act as a passport confirming their own status. For successful transplant, the HLA of the donor and the patient must match. Otherwise, the T cells recognize them as an enemy and attack.
Chemotherapy induces bone cell apoptosis via DNA alkylation. Busulfan binds to guanine or adenine, disrupting the structure. Stem cells are fixed in the niches of the bone marrow, interacting with these stromal cells. Afterwards, new stem cells take root and turn into new blood cells, which then restore immunity.
So now we'll focus on the possible economic implications of hematopoietic stem cell transplantation, or shortly HSCT. First of all, you need to know that HSCT is one of the most expensive treatments for leukemia. According to Broader et al. 2017, the cost including hospitalization, medication, and following care usually exceed $300,000 for one patient. But I don't have that much money. Well, if you choose HSCT to cure leukemia, you need to first evaluate your financial situation and perhaps seek support from government or non-profit organizations. If your insurance does not cover that, you can follow the link in the description from Leukemia and Lymphoma Society, where you can find different patient financial assistance programs with stipends and grants. But these grants will barely help you to fully cover the expenses. Here you can see the data and graphs that show the high cost of HSCT treatment, which costs thousands of dollars and euros for proper treatment in pharmacy. But most of the expenses are for HSCT admission. Since most of the information and data is provided for the US, we can take an average American household which has a median income of $80,000. An average household in the US spends almost all of its income by saving only 4.51% of money. By multiplying the median income of households in America to the saving rate, we get the number which can be considered significant in our further calculations. We have used a personal loan calculator, which showed that the monthly payment will be slightly over $2,000, while total interest payment will be equal to $21,658. This number can be considered by us as an acceptable cost of curing such disease as leukemia, but it still causes a financial burden of constant payments to the bank for the period of 5 years, and some families can suffer from that. But hold on, there's something else that will also lower the chances of getting proper medical treatment for leukemia, such as HSCT. Are you kidding me right now? What are you talking about? No, not at all. If you are from a less wealthy country, your motherland is likely to perform less HSCT rates than more developed countries. Also, according to Gretel et al. 2015, countries with less AGI, i.e. Human Development Index, and GNI per capita tend to have higher mortality rates for HSCT.
But what about positive implications? You have mentioned only the negative ones.
Of course, there are some positive sides of that. Studies have shown that HSCT treatment helps patients to restore their economical life. For example, according to Scory et al. 2019, in just 1 year period, 62% of HSCT patients return to work, and in a 5 year period, 77% of HSCT patients are able to work again. This benefits not only individuals, but the whole economy by reducing unemployment and increasing productivity.